Okay, so we are live. Good afternoon, everyone. Hello, Europe, and hello, Canada. My name is Marilena, and as the project coordinator on behalf of Europe, I am very excited and proud to welcome you to our very first speaker series. Before I let our lovely moderator, Lisa, go ahead with the discussion, let me just give you some information about the project and what we have been doing so far. The project, our Digital Futures AC, is coordinated by 3 partners, the Goethe-Institut Montreal, Carrefour Jeunesse Emploi in Canada, and Think Young in Europe. The project is funded by the European Union, and under this umbrella in 2019, we realized several on-site actions called Thinkathons, but now, due to the ongoing COVID-19 crisis, we have shifted to a completely online concept. The overall aim of the project is to connect European and Canadian youth with policymakers in order to address opportunities and challenges of the digital world, and more specifically to foster an exchange of views between the young people on key parameters in order to ensure that we have a digital future which is inclusive, to enable them to jointly contribute to policy discussions, and last but not least, to increase the public awareness by initiating a broad public discussion on the topic. As mentioned, this is the first out of the 4 thrilling speaker series that we have organized with experts from Europe and Canada to exchange on how to make our future digitally inclusive for youth. And every time we will have a different topic in discussion. Today's topic is about the advantages and disadvantages of telehealth, of the exclusion of rural areas, and many more. Our speaker series is taking place at the same time as the Thinkathon online challenge, where young adults will create policy proposals in the topics of racism, anti-racism, climate change, gender equality, education, and health. Our goal today is to give food for thought to the people that have already registered to participate in the project, but also to motivate and inspire further youth to connect with us and to sign up. Just a small reminder that the registration closes on the 1st of December, so you still have time to register and give us your ideas. Last but not least, I would like to thank the European Union for making this happen, as well as our main sponsor, Agorize, and all the promotion and recruitment partners in Europe and Canada. Small reminder that we will also have some Q&A period, so feel free to write the questions that you have for the panelists under the streamings, and we will be able to share them with you with the help of Lisa. And now, without any further delay, I would like to introduce you to Lisa. And Lisa began her journalism career as a financial reporter in Investors Digest and then Rogers Media. And after being diagnosed with rare blood cancer, Lisa founded the Canadian CML network, and she shifted her focus to healthcare advocacy and education. Lisa, welcome, and go ahead with the panel.
Thank you, Marilena. I'm very excited to be here. So yes, as Marilena said, I live with a rare blood cancer. I also run a patient advocacy group here in Toronto, Canada. I'm also the executive producer of healthing.ca, a health education advocacy website, also here in Canada. So we've been talking about digital health for a really long time now, with some systems, all talk and no action. And then the pandemic happened, and instantly we have digital health. And while using technology to provide healthcare has a lot of benefits, such as ease of access for those in rural areas, the ability to get health records online, and perhaps faster service, there are also some downsides, such as the exclusion of those without technology, the widening gaps between the have and have-nots, privacy concerns, and the public perspective of digital care being impersonal and somehow not as good as in person. So joining me today to talk about digital health are Sela Rogan, research assistant at UBC Medicine Centers for Rural Health Research. She's an undergraduate student studying genetics and physiology. Aidan Scott, the co-founder of Speakbox. Biela Roberts, president of the European Health Parliament and manager of Vaccine Policy Europe at MSD. And Andrea Reich, director Health Systems, Medical Products and Innovation at DJ Santé. So let's start with our first question to kick off the discussion. Let's start by going around the table and sharing what telehealth means to you. Aidan, I'm going to throw it out to you first.
Sure. Thanks, Lisa. And hello, everybody. Great to see everybody and join this conversation with such an amazing panel. For me, telehealth means two major things. One, access, of course, especially in rural and outside of any metropolitan center, but also with the right systems in place, better health equity so that all people can live a happier, healthier life.
Andres? Oh, I think you're muted. You're muted.
Yeah, the part of this digital challenge in COVID is that you are using all kinds of platforms. I don't know which one. You should start. So good afternoon or good evening, good morning, still in Canada. So my definition is always tricky, because if you say too much, you are in the wrong side. If you say too little is too little, so also wrong. My understanding of telehealth is that we can provide services under almost not limited conditions up to moment we have access to the networks. Okay, so whatever, we don't know yet most probably what kind of services, because the space is just open.
What about you, Sila?
Thanks, Lisa, and hello, everyone. To me, I think that telehealth does mean increased access and quality of care, especially for rural Canadians as well as rural residents across the world. And additionally, is a solution that could potentially reduce travel times and therefore greenhouse gas emissions within the healthcare sector.
Yella.
Hi, everybody, and thank you so much for inviting me. So for me, telehealth is also really providing tools that allow health communication, but also health education, whether that's for providers or for citizens, for example, and really boosting that connection between caregivers, healthcare professionals, and citizens and patients. So for me, telehealth really represents accessibility for sure, but also sustainability and resilience of our healthcare systems.
Excellent. So those are all really, really great questions. And what I wanted to take a look at now was, how do you think, so we have your perceptions and you are some of the leading minds and innovators in this space. Now, how do you think patients and users perceive telehealth and digital health? And then I want to look at the gaps in those, because I have a feeling you are going to tell me about very big differences between how users perceive digital health and how you envision digital health. Okay, Aiden, I see you nodding, so I'm gonna put you on the spot.
Yeah, I think what's fascinating and interesting for me, I was just having a conversation, happens to be Digital Health Week here in Canada, so it's a very active conversation, and was considering the idea of just everybody's familiarity with technology. Put health aside for a sec. Banking, Netflix, online streaming, social networks. There's so many digital features that are so embedded into our day-to-day lives. And often what I hear most from the public is actually a frustration, is that what they think telehealth should be doesn't echo what they see in technology elsewhere. I can go onto my online banking right now and I can see my financial statements for the last 6 months. But is there any way that I can log into my health record and see my health record for the last 6 months? Some of my EU colleagues would be like, well, we can in Canada, we can't. And so I think telehealth is one of those things where almost to the public, maybe a perception of hype without results in a lot of ways. So maybe I'm already jumping into some of the barriers there.
Well, I guess, we do have some European representation on the panel as well. So I'm going to put it out to either Andreas or Biella, if you want to comment on the European experience in terms of what Aiden is saying and access.
Yeah, I think that I would love to believe what Aidan said, that we have such easy access to our medical records in Europe. No. Depends, which part of Europe you go. You go to Estonia, you will live in this paradigm, because the Estonia, just decided to go digital, which is, by the way, phenomenal in the sense that the concept of digitalization started started exactly from the question: should we digitalize everything? You know, it was the beginning of '90s when some of, by the way, Canadians, Estonians arrived back home, and they told me the story. I remember the former president of Estonia, who was the leader of this project. He said, you know, there was nothing there. There was no highways, no electricity, easy supply. So we said, you know, so what we can do? Go digital. And they in one hand, they liberal economy, but also they decided that whatever they do should be think digital. And this is how the process started. And frankly speaking, the health was one of the last sector which became digital. But the user experience from banking sector, for example, the ID recognition, which we have struggled so much in many countries, the time they trigger digital operation in health, they already knew they can use, I think, 4 or 5 different ways of ID identification. So it's very important for patients, for healthcare providers. In other parts of Europe, of course, we have some countries with more or less similar speed or following the same speed, like Estonia, like for example, Denmark or Scandinavian countries. They generally are very, very boosted from this. But the great phenomenon is Germany. You know, Germany, thanks to the great leadership of current health minister, they are jumping, you know, from the almost no be digital 2-3 years ago to really going digital, but with a complex reform, which was accepted the year before by Parliament, by Bundestag, and now is a full frame. When you digitalize, you know, services, you make sure that data are available, you know, to number of operators. But also, what is important, they are supporting startup community to develop the digital solutions to allow, you know, kind of innovation and digital solution reimbursed by the Krankenkasse, by the insurance funds. So they close the loop from the kind of creation of data, digitalization of services, but also pushing innovation. So you can see this leapfrog, but also in the Estonia case, you see the kind of good beginning, you know, for the whole country.
And I would say that that's the same here in Canada, where we have, you know, some systems are way ahead of others, and some seem to know the secrets, and some are trying to figure them out. I did have one question in terms of your thoughts on how users are perceiving all this technology, though, Andreas, in Europe.
Oh, the users, I mean, depends, you know, users could be the medical doctor, could be hospital, could be patients, could be insurance fund, you know, depends which one you try to ask the question. I think for patients, I think I have seen, for example, a recent study by Minorities, which is the European Association dealing with the rare disease patients. So the COVID showed that, you know, somehow the access for the knowledge of specialized knowledge was easier because, you know, we don't travel. You can really find the specialist. You can schedule your meeting. But at the same time, you know, the patients said that they would like to have the first visit physical one, and you know, there is a most probably. The also sometimes fatigue of patients with the tele kind of interaction, or whatever we call digital health or tele consultation. In country, you know, West Poland, you know, it was really kind of almost pushed by insurance funds through the kind of some financial stimulus to push GPs to provide more direct advice to patients, not the phone calls or smartphones, because patients were calling, "Can I see my doctor?" So this is one extreme. The other extreme is that simply generation problem. You know, we have, you know, sometimes older generation and often, of course, more sick, more chronically sick. It's having still barrier, you know, to use different tools that are provided.
Right.
But at the same time, you know, in other end, you have healthcare providers. They are not skilled, not prepared to get into interaction with the digital solutions. Or digital solutions, I also hear from a number of healthcare providers, are too difficult, too complex. They are not user friendly. So as they say, it's easier to send WhatsApp message with the ECG result than to have very secure system which will work, for doctor and patients. So people are compromising, as I have seen now during the COVID crisis in one country. ICU doctors, they told me, we love that we are talking about great cybersecurity regime and complex system, but when I need to make my decision and get the results, I do WhatsApp. And this is, of course, the also question to developers, how to find the right tools, to attract both doctors or healthcare providers and patients to use the solutions we would like to offer to them.
Sila, do you see that out in British Columbia?
Yes, I think that Andre mentioned something that was really important, which is making digital health interventions more user-friendly. And I think it's super important to remember that the development of digital technologies is shaped by lived experience. And if you're serving a heterogeneous group of patients, it's important that their lived experiences are reflected within the development of digital technologies. So I think that making web development a little bit more accessible, as well as really making sure that these digital solutions do work for the people who are using them, is so critical for them to be.
Yeah, I would agree with that. And we were talking earlier before this started about the value of lived experience, and I would almost, as a patient advocate myself, I would almost say that we also need to help people value lived experience first, right? Before it starts, becoming a larger part of our healthcare system. Biela, do you have anything to add on the European experience?
Well, I definitely agree what Andrea has said so far. And I mean, the COVID-19 pandemic has really underlined the value of digital transition in health and really having those digital solutions, because of course, during the pandemic with social distancing and really having those restrictions on healthcare services, we did see a lot of increased use when, for example, e-prescriptions or teleconsultations, because there was no other choice, and to continue care. So I think there is a great value there. But indeed, it's very important that the users experience it in a positive manner. Mm-hmm. And I think there have been some studies that overall patients were quite satisfied. Of course, it depends on the person who you ask, but also on the healthcare professional, for example. But I think overall, if we, manage to make it user-friendly, for example, have easy personal appointment options, make sure there is a virtual follow-up session, etc., and really making sure those next steps are in place as well after such consultation. I think there's definitely a lot to gain here, and that digital health can contribute a lot to our future healthcare systems. But indeed, it's a matter of implementing it in an effective way that is user-friendly and definitely surrounding the citizens and the healthcare professionals.
Absolutely, and it's not necessarily an easy undertaking, for sure. So we've already talked about some barriers. I wanted to address one thing that's super important, especially as the pandemic has ramped up, is how do we avoid excluding parts of our demographic, geographical, how do we incorporate young adults more in telehealth? I'd kind of like to go around the table and talk about ways that we can address those barriers, as well as other barriers that each of you might envision. Okay, Aidan.
Yeah, happy to quickly jump in on this one and look at it, especially from a mental health context. That's my background and where I work. And so you touched on some really important points there. And one is to recognize that telehealth can't develop into a privileged tier of healthcare. It can't be exclusive to somebody who has the latest iPhone or the latest computer device and the highest of internet speeds. That's just not the goal of health. Healthcare is meant to be universal. That's why we have universal healthcare systems in so many of our countries, or at least we call them universal. There's gaps in them still. And so I think as we continue to develop digital health, I think we always have to be mindful of not the most premier services and the most premier technology, but what's the most accessible technology. And also what we've seen elsewhere in the world, actually, some of our US counterparts and things like that, is supportive government policies. We're starting to see things like, and just national, international conversations around internet access. Internet access seems to be, in our modern world, more of something that should be a right. People deserve access to the internet. It literally changes lives. It changes people's access to information, knowledge, health. And so with this is the geek coming out of me, Elon Musk announcing, Starlink, and this idea that, and you've got multiple commercial players now looking at basically creating internet access to anywhere you are on the planet, which is incredible. And so I think we need to not just necessarily talk about specific to health, but look at those surrounding technologies and surrounding innovations, and how can we move those to a health context? Because I think of our northern territories in Canada. I think of Nunavut in Canada, and Iqaluit, and those different communities that very much need health and very much need access. And up to right now, having friends in Nunavut, they talk about our internet goes out during certain times of the day just because where we are in the northern circle and things like that. I was like, oh, in downtown Vancouver, I really can't relate to that. I don't know what that's like. And so I think the last point that I would say as we start to innovate in this space and hear about the barriers is we need to make sure we have diversity of voices at the table. It can't just be, metropolitan people innovating for metropolitan people. We need to have full national voices on this, and we need to do engagement campaigns and conversations. We need to go out into the communities, and we need to understand where people are at. And then the last point, access and open notes and information. Speaking specifically to mental health, we always seem to be the lagger in a lot of health information and health innovation in general, for some very archaic beliefs on the treatment of patients in the mental health space and field. And certainly there's still a systemic stigma that exists within that area of healthcare. And I think as we continue to advance digital health, where there's so much fantastic opportunity in the field of mental health, that we continue to break down those walls of stigma, and we can continue to create access, create open notes, large movement in the US around open notes and patient access to that. So we need to be on those bandwagons, and we need to see those through.
When I hear Aidan, I of course, I cannot stop thinking about my other chapeau, because I am part of the Lancet and Financial Times Commission, which was hired to basically reflect the young people, a new generation kind of in digital health in 2030. So this is our target. We just met during the last 2 days, discussed this, and I hope you will contribute, because this is one of the ideas. Also, bring you voice, younger people, younger groups like you to this commission. But what is of course challenge for us? This is basically try to ask question. What will be the healthcare of 2030? But you can reverse the question, if you don't have any healthcare today, with this new approach, as you mentioned, for example, in mental health, with a new way of thinking about sharing data or sharing knowledge or getting access to the best people around the globe, how this 2030 will be reached, So starting from blank page maybe is better. Because of course, we see the problem when you try to change the system. You have so many barriers. Maybe it's better to start from scratch. This I don't know, but this is intellectually, I think, challenging exercise. I give you an example which Australian colleague told us yesterday morning. She was assessing now the current experience of Australian psychologists, psychotherapists using during COVID. They started, from day one to have access to digital platforms to advise patients. The problem is that we need also to assess these results. And of course, we have the kind of old school of assessing, the system. But at the same time, we have new tool, which you call, I understand, digital trace. So with this digital trace, you can either you tell me more. You can assess better what was done than before. You just have patients, for half an hour in the mental health area, and you really don't assess, because in the digital solutions you can do much more. But of course, we are not there. You have still old kind of fashion therapies trying to use new tools, but without kind of thinking about the options you can offer. So I think this is most probably huge challenge for your generation, to see this from the blank page, but of course somehow be confronted with the existence of psychiatrists, mental health doctors, or psychologists, the conflict between of them, the competences problem and so on. But let's be open, and maybe also for this debate, it would be good to open our brains a little bit.
And Sila, you mentioned earlier, I mean, the one of the big themes in all of your discussions and all the times I've talked to you is creating, like, looking outside the box of heterogeneous communities, right? You want to make sure that we address all of the demographics and the needs that are out there. So can you just talk a little bit more about how we think we can address those barriers, and also if there's others that haven't been mentioned?
Thanks, Lisa. That's a great question, especially within the context of making telehealth solutions more accessible. I think that, as Aidan mentioned, internet access is so important for all communities, especially rural ones in Canada. I think that the success of telehealth technologies is really dependent on the telecommunications infrastructure that's available. Additionally, I think that it's really important that while we're developing these technologies, we're making sure that they're accessible to all people. So, for example, people with audio visual accessibility needs, it's important that these solutions incorporate and meet those needs. Finally, I think that we talk a lot about youth and how important it is to engage them in these conversations about telecommunications, which as a youth myself, I totally think is super important. But I also think that it's important that we engage with the elderly when developing these. Digital literacy is a continuous issue, I think, as we increase in age, and just making sure that these solutions, which may be used by the elderly the most frequently, meet their needs and are user-friendly for that population.
Mm-hmm, mm-hmm. Yeah, that's an excellent point, actually. And I think that we would be surprised as how many elderly people actually use technology, right, in ways that we can't really imagine. I know, like in my job as a journalist, I'm always surprised at how there are some aging Canadians who are so agile at technology, but then also there are the ones that are not, and they're losing out on all of this. One of the things I wanted to touch on is privacy. I mean, we've kind of just sort of skated over it, but for users, privacy is a big concern when it comes to using digital health. I mean, things like, are my health records confidential? Are they secure? What if there's a data breach? Can my insurance company find out that I have this disease that's going to cost them money later down the road? And I think that for a lot of people here in Canada anyways, that these concerns pose a bit of a barrier for them to use telehealth, which is a huge problem in a pandemic when telehealth and virtual healthcare is all we have really right now. So I'm wondering if we could talk a little bit about your thoughts on privacy, and also how we can address those issues.
So maybe if I can just jump.
Go ahead.
Yes.
Sorry, just very briefly, because indeed I do see those data concerns, but I think it's important to highlight as well that sometimes it's more dangerous not to use data than to actually use data. Of course, it has to be safe and secure, and being used in an effective way and in a very safe way as well. And I think it's very important that we build citizens' trust also with regards to this, for sure. But yeah, I mean, we rely so much, especially now during the COVID-19 crisis, on these digital tools. And I really hope citizens also see the value in utilizing data. And this is also, for example, when we look at epidemiology or monitoring. I mean, we can use this data to better prevent, but also better see outbreaks. For example, if we look at infectious disease data, see outbreaks happening and being able to respond to that. So there's a lot of benefits that are bound to data use, but of course it has to be used in a safe and trustworthy manner. And I think Andrea definitely is able to elaborate more on that one.
No, I follow your line, but I understand in Europe, Europe is now known as a GDPR region. So it seems that we are defined now globally as a GDPR region. Some people say this was quite challenging exercise for many, but at the same time, the solution we found in Europe, of course, trying to balance between privacy and access and the data and so on, was not bad finally idea, because somehow we help the users of data, of course not only in the health sector, to control the kind of data and keep privacy and so on. But at the same time, there are systems allowing to use those data. So somehow, if you like to use data, you can, but there are a number of provisions, and regulations. But also the second point I'd like to make this is about the primary health data and secondary data, because it's a big difference. If you have access to my record as an insurance company or whoever would like to use them against me or against my family, against my financial stability, of course it's a very critical thing, and here we have all issues around cybersecurity. You remember during last years we have number of problems in because of hackers entering to the hospitals and also some kind of commercial deals between the companies and hospitals to use the data. So these issues are very sensitive, and also I think we need to invest more, through the regulations, through the infrastructure, through the also digital solutions to protect data. But of course, even those data you can use when the consent of the patients is done. So it's not that this is the important part of the GDPR. Patients can consent to use their own data in the benefit of the research or in the benefit of the own clinical situation. And the third element I like mention and finish is about this the secondary use of data. And we have excellent now laboratory because of the tracking and tracing apps used for the COVID. So we have now in many European countries, those apps were developed. They were developed based on mostly on decentralized system. The only centralized system so far in this is in France and also Hungary. That must be Hungary will change to the centralized system. And this is very interesting, how in one hand we regulate this and we found the regulatory solutions for this using GDPR, how it was found kind of complex relations with companies, with Google and Apple, because to have access to the hardware and operational systems of those smartphones. And the third element, how now those apps can be recognized across borders. So we have interoperability issues. So we can do it. It's a very complicated, very complex solutions. But finally, in the end, the big question is why, in so many countries, we still have relatively small number of population using these track and tracing apps to get the real kind of most probably proper use, when we will have at least 50% of researchers, 60% would be best minimum to get the really tracking system operational, in the population. And we are coming to the big issues, great digital solution, great ideas, good regulatory system, but finally the key is end user.
Right. And actually, that was my next question, because I don't know, like how I'm interested to know your thoughts on how do we get people, users, to believe that, yeah, technology is safe, right? That, like Biela and Celia had referred to the use of data, how that's really important, right? But how do we have that conversation with patients and users? How do we get people to sign up for those tracing apps? How can we translate the importance and value of those tools to the people who really should be using them? That's my question.
No, I think we should address to all, but my first reaction is, when I see mine, because I have Belgium app in my iPhone, and I am using, it's use itself, I just put my Bluetooth on. But I was thinking when you were asking this question, which apps I will never take away from my system is my banking app.
Right.
In my banking app, I have to have, because all my transactions, at least in some fields that depends on this app. This is the only way I can control my expenditures or my. But also, so somehow, I am glued to my banking app, and I would be unhappy to lose it. But at the same time, I was thinking about this tracking and tracing app. Can I have? Okay, I did this because of my kind of research interest, if I may say, and public health kind of understanding. Mm-hmm. And 2 million Belgium did, in 10 million population. So it's not bad. Belgium is started very late and is doing relatively okay. And we see, of course, the stimulus when there was more cases of COVID in Belgium or in Germany, the uploads of data were quite high. But I also heard from one technology providers in Germany. They said they understood they should also offer the smartphone with Android and in cheap price to allow people, older generation or people with a lower income to buy those smartphones, which the price was I think 90 or 80 euros, to get those apps available. Because of course there's minimum also level of technology to allow them. So right. I conclude, we have the question of individual kind of trust in the needs, mm-hmm. security, and of course finally we also need, this is a price to access.
Aidan, what do you have to say about that?
Yeah, so many. I'd echo so much of what's already been said. Some very sound points, and it goes back to. I think we've almost done this. Health data is important, absolutely, but as a public, the way that we talk about health and the privacy of health, we've put health in this weird, exclusive pedestal in our lives. You have people who, I mean, I'm making some huge generalities here, but there's people who'd probably be more comfortable talking about their banking than they would ever talk about their health. But the honesty, like, health is it's what makes us human. Like, we're human. We have health. We get sick sometimes. We are well sometimes. And yeah, I'm skirting over some serious stigma here. But honestly, that is the truth at the end of the day. And digital health and digital security is the same as any other major, district or industry. Security never is one and done. Security is an ongoing process. I'm echoing our chief technical officer right now. There's never a day that you are secure. There's always people trying new ways and new things like that. But then also I look at myself and I'm like, I am a very insignificant person in the 7+ billion people that live on this planet. And so, is there a chance? There's a chance just as much as like my banking information could get out there, and I would deal with it, and there's systems in place to deal with it. So I think it's not about giving people some sort of false promise that there is never going to be a data breach. There was a data breach in one of our labs companies here in BC. That lab company still does blood work today. The public bounce back. Things still happen. And so I think when we talk about privacy, I think we just have to open it to a conversation that's just very transparent and honest, and not doesn't try to achieve something unique to health and make false promises to health, but start to just normalize people, like very much, I need something on my phone as that's intricately connected to my health as much as I need an app on my phone that's intricately connected to my financial health. And that's just the way of modern life in the world. And then I would say the last points, and just echoing some of my colleagues, is data stewardship, public data stewardship. Like the problem that we have is we have all these data silos. And so if you go to one hospital, they might be using one healthcare system, an electronic medical record. But if you go to a different hospital, or if you go to a different community clinic, they might not be using that same system. So in Canada, what we're seeing is, a trend towards potential portal hell, to be crass. But if you're like myself, my own journey was in mental health. I access multiple care teams, multiple systems, multiple providers, and none of them had interoperability of my health record, and they still don't today. And even in the world where there might be a portal, I could access my hospital's health portal or things like that, it's exclusive to that hospital. So my health record is always incomplete. And I think something we need to really move towards, going back to that banking example, is all my banking is in one place or within a few apps. The same too needs to be true for health. I need a complete picture of my health. My healthcare team needs a complete picture of my health. And that includes my self-reported information, things like my Google Fit and my running and my exercise and my physical activity and how much did I get outdoors, my mood, my emotions. There's so much valuable data that I actually generate on my health every day that right now there's not a good mechanism for that to be integrated into the healthcare system. And so I think we also need to address that. And at the end of the day, again, I'm going to give a simple solution to a complex problem, but it's shifting our data not from being system-centric, but being person-centric. If an individual is at the center of their healthcare as much as they're at the center of their digital data, then it's not about them accessing a hospital. It's about the hospital accessing. That should be the data steward. That should be the touch point, is the individual should be moving with their health record and their health information. And then no matter what healthcare door, much like Interact Debit here in Canada, that's how easy it should be. Like, here is my health record. I would like health services from you, and I'm opting you into my care team. That's a very empowering future for us as patients in a digital health world.
Yeah, I agree. I actually really love the financial model example, Andrea, because I think it's so interesting that healthcare is so important, yet still no one really takes the time to ask the user. We don't have like customer service surveys. The banks do everything. They're stumbling all over themselves to make sure that we've got this very comprehensive financial health technology to access, but yet still healthcare systems sort of have left users on their own. So, I would like to be able to use my portal and then get a little bubble up at the end that says, hey, how would you rate your, rate your service, right? Or how if you didn't like your, the way your experience went today, call us here or whatever. But I think we're years out, years from that. Biela, I don't know did you have any comments on the whole? I really wanted to. We've heard a lot from the Canadians. I'm wondering from the European experience, if we could turn it to our. How is Canada versus Europe doing? Are we working well together in building these systems, and can we do better?
Well, this is an interesting question because indeed, cross-border collaboration is always very important, and there is a lot of lessons learned that we can use from each other. To my knowledge, I mean, I'm not very connected to the Canadian healthcare system or their digital advancements in health, etc. So that's also definitely something why these webinars and this panel is of such relevance to really learn from each other there. And I think we can definitely keep an eye out on each other because, for example, what we see in the Nordics, in Europe, we have, they're really taking the lead on digital health with their registries, for example. And I think, hearing Aidan discuss the Canadian side, I think there is lots to learn, and definitely something that we can enhance this
Do you
collaboration.
think Europe is doing a better job
in
than
my
Canada?
opinion? Tricky question. I'll leave that to
Aiden's
Andrea.
nodding.
No,
It's okay. Don't be offended.
Aiden, you think so?
What do you think?
No, frankly speaking, I don't think it's easy answer, because Europe is relatively kind of diverse continent, and because of different the smaller countries, bigger countries, regional solutions. For example, you go to Spain, you will find Catalonia and Basque countries. They are in the opposite part of the country. They really are doing great. We always use the examples, but they have also quite complex development in the whole health system. And maybe I don't like to speculate why these two sides of Spain are doing so well compared to other regions. Maybe Madrid is the third one. But then you travel, to Italy again. You will find the regional, differences. Veneto ahead. By the way, those show very interesting, how they're doing better than Lombardy, which is the same rich part of the Italy and industrialized and so on. But because they have much better health systems prepared for COVID, so prepared for the and respond to the COVID threat. So we are learning, also so many lessons during last months, that most probably, this is when I liked when Sila said about the reducing the carbon print. I was thinking, about our discussion just 2 days ago in our team in the commission. We reduce so many. We don't travel now on missions, so people are not coming to Brussels. Maybe it's not very, very nice, but of course, I don't see planes above my head now in my house in Brussels. But at the same time, of course, the question is what we are gaining, what we are losing. But what's very intriguing, what I found in this world of the challenge by COVID. Access to expertise now in Europe, thanks to the new way of working, is unbelievable. You can get the best experts from AI, from management, from complex engineering things around the table for 1 or 2 hours when you are making decisions. It's so I think we for the patients exactly the same. How to use this challenge to make this sustainable also after COVID, because maybe COVID will finish and we say, okay, we are done, let's go back to normal, means the patients back to the waiting list.
Sila, what do you think? Do you think, I want to get back to the COVID question in a second, because I think that we have been building significant momentum in virtual healthcare, and I'm curious as to know if you guys think it'll continue. But Sila, I wanted to get your thoughts on how Canada's doing. What do you think? From where you sit, are we doing a good job?
I think it's really hard to say. As our European colleagues have mentioned, there's a lot of diversity in healthcare systems in Europe. And I think the same could be said about Canada. Coming from a bunch of different provinces, I was actually born in Iqaluit, and then my family's in Manitoba right now, and I'm currently based in Vancouver. And even just seeing how different the COVID-19 responses have been across the board, I think that I would say that it really does vary by region. I think that there's so much that we can learn, though, from each other. And that's why I think that events like this are so important. Although, we may have very different and distinct needs and distinct COVID-19 responses and other healthcare responses, I think that, there's so much value. And even just through this webinar, I've learned so much about digital health. So I hope that we're able to form more collaborations in the future.
So that leads into our final question, which I want to know. Imagine if we were sitting down 5 years from now, having this exact conversation. Hopefully the pandemic is just a far off nightmare. Have we maintained that momentum? Are we grand steps forward in terms of what our telehealth systems look like? Are we still in the same place? I wonder if we could just go around and give me your ideas of what the future is going to look like. Aidan, I'm going to start with you.
The hot seat. Yeah, I love this question for multiple reasons. I mean, certainly wearing innovation hat and being a co-founder of a startup that's literally working within the mental health space, I'm very optimistic for where we're going to be, even in the next 5 years. COVID has been the catalyst that our healthcare systems in Canada needed. And I don't think there is going back from where we're advancing to digital health. First off, just because of the pure cost investment in digital health, they're not going to just strip that away all of a sudden. That just wouldn't make any sense. But because we're starting to see clinicians actually seeing the benefits. And oftentimes it was less about public will for digital health, but it was clinical dissenters that just didn't want to adopt, a new way of being. And now, because there's a safety element and social distancing, now suddenly those dissenters are overnight. They're like, yes, I love the idea of talking to somebody over video chat. And for the future, where I see things going is we need to actually move beyond seeing virtual health as simply video chat. What we're doing right now, is not virtual health. We are having a virtual conversation, and that is a key tool and necessary for healthcare to be delivered. We need to be able to have communication tools, but it's not a healthcare tool, it's a communication tool. And so what we're going to see in the next coming years is an evolution of platforms where you're not just going to be chatting over video, but clinicians will have insights, like I said, patient reported measures. So the ability to, as the individual, start to set priorities for what you're looking to get out of your healthcare, and then your care team will wrap around that and help you achieve those goals in your health journey. And so you're going to see a far more immersive healthcare system. You're not going to see you're going to start to see a broadening of the healthcare journey. I think you're not going to see people just strictly in two buckets: sick or not sick, ill or well. But you're going to see people moving much more to proactive care. You're going to see doing more preventative work because of digital technologies, and people being able to address their health on a day-to-day basis, particularly in mental health. Mental health, by definition, is something that all of us have. Every day, you and I are doing things to care for our mental well-being. And none of us, if we had a honest conversation with ourselves, would say, I'm going to put off my caring for my mental health until I have a mental illness. I'm going to wait until I have depression, and then I'm going to want to access healthcare. Nobody says, no, I'm going to be, run for a marathon, but I'm never going to stretch until I, severely hurt my knee, and then I need to go to complex clinicians. Nobody says that. And digital health in the future is going to be allowing us to accomplish that, and to have healthcare just be part of our life. It's not going to be that I need to walk through a door and schedule a meeting and wait in line. It's going to be right there. It's going to be on my mobile phone. Imagine I'm holding a mobile phone. So that's what excites me.
That sounds amazing. So I wanted to get the European perspective. What do you think Europe's going to look like? And then we'll give Sila the final word, and we'll take some questions. But Europe, what are you guys thinking, Biela and Andreas? In terms of the future?
Bella.
Well, I really hope citizens really gain some trust and really understand the value of digitalization. I think we'll have a healthy mix of face-to-face appointments, but do leverage the digital opportunities, especially as Aidan also mentions with mental health. For example, through digital solutions, we can have more peer-to-peer interaction, etc. We wouldn't normally have when we visit a healthcare professional. So I really hope it opens up more to these more innovative ways of health, and indeed prevention as well, which is a very big role here as well. And really use these opportunities that it will have to offer. And I think especially young people can also bring a lot to the table here and help create this sphere. So yeah.
Thank you. Andreas, anything different than that?
Yeah, we'll follow a little bit on Brayla points, because I also believe there will be kind of hybrid solution, because I think we need to compromise, that, as I said, the patients, me as a patient, I would never somehow in my age, I would not agree that having only my phone, with all my good feelings about digital health, I really would like to see my doctor time to time. But it's also true, I don't like to see him maybe so frequently, because it's if he can provide the same quality, this is the big if he or she can provide the same quality of care and advice to me as we do this in the interaction. I think that what will change, I mean, I agree with Aidan that the tele kind of medicines, not only the video chat, we need really to see more tools employed. We have a lot of development in tools like digital therapeutics. Would be very interesting to see how this really works in practice. We'll see most probably more advice for the medicines users, how to build the software together with medicine, to allow better compliance and adherence to treatment. How to make sure that our data from our wearable devices are somehow helping with the management of our disease and prevention and so on. Yeah. So I think we this hybrid needs to bring also innovation which help basically with all these things together. And finally, also be great if the regulators like FDA or Health Canada will be able to assess also the quality of treatment, outcome of treatment, hear the patient's voice in this field. So patient's reporting system, which basically will say, okay, there are some guys that are doing a very good job, but there are also some crooks in the system. So they should be not anymore, beneficiary of the because I think this is a big questions about the quality of services and outcome as well.
Right. Now, Sila, last word.
Oh man, lots of pressure. I think I should really echo Aidan and what he said about COVID-19 being a catalyst for really transformative change in the healthcare system. I know that here in British Columbia, changes in telehealth and rural health that we said would take like 10, 20 years or were just completely impossible off the table happened overnight in response to COVID-19. And while that like transformative change is really exciting to me, what's even more exciting is that there are measures being implemented to make this change sustainable and really like implemented in the long term. So I think in 5 years, I would really like to see transformative change and innovation being used to create a healthcare system that's more accessible and really does meet the needs of like all citizens. But I think to make this a reality, it's so important that we have these conversations and ask like some of those harder questions. Thank you.
Thanks.
I need to add something which I've forgotten, and this is for me as a former educator. I hope we in 5 years will see the change of the curricula of the medical school, nursing colleges, really preparing also new generation of health professionals to these challenges, because this is something needed. I really believe that we need, we also need new type of jobs. We need data analysts, helping with the thinking process in the health system. But really, first we need to make a new generation of health professional working.
I agree. Well, thank you so much, all of you, for all of your comments. We have a few questions that we can use to wrap up the session. So I'm just going to read it out here. Thinking digitally is the key, as I understand, till now. But how easy is it to develop digital and innovative health services? And which European countries or Canada have made such progress till now? Anybody want to take that one?
I can say really quick thoughts on that is, strictly speaking, the actual technology isn't often the most complex part to develop. We have some very smart people around the world that are developing fantastic solutions. Oftentimes the limitation for digital technology is actually policy and systems willing to accept them. There's very innovative startups, but there's a lot of slow-moving healthcare systems that sometimes don't want to bring those in. I think a fantastic example that I would say from a systems perspective that we have here in BC is integrative care clinics for our youth population. So one thing that we're starting to see is healthcare is amalgamating not just around singular health issues, but around people. So recognizing, for instance, in these clinics, youth can access things like financial support, sexual health support, mental health support, general health support, all in one place, one door. And so those ecosystems create fantastic opportunities for digital health to enhance the clinical work that's already taking place.
Mm-hmm.
I would add to this, what is interesting also in German solution now that you have, in one hand you have the startup community or developer communities, you have the medicine agency, which is assessing the digital products and services, concerning the safety, quality, outcome, but also security and so on. And then you have Krankenkasse that can reimburse, and then you have kind of digital products on prescription, which is changing also the dynamic, because it means when doctor prescribe is also somehow is committing, to use it, together with the patient. So I think we need really, as Aiden said, really have the complex system.
Mm-hmm.
It doesn't work if you develop a beautiful solution, but it's not the way to implement it.
Okay. Do you think health tracking apps and devices such as smartwatches allowing users to monitor certain parameters like their heart rate will play a growing role in medical care? Are they empowering people, encouraging them to pay attention to their health?
Yeah, I think so.
As
a user.
Mm-hmm.
No, we will see most probably, we see in the engineering field, there are so many devices growing now. And we see also in the field of clinical trials, with a lot of discussion around the globe, including EMA, Health Canada, FDA, to see how in clinical trials, we used to have to build a clinic to do clinical trials. Now you have put all this nice monitoring system on the body of the patients, and really have kind of real clinical trials in the setting of the patients with normal life kind of the patient.
Mm-hmm, mm-hmm.
Will be more.
Yeah. Thank you, Julia, for that call or for that question. Do you think lack of competition is one of the reasons why hospitals and the public healthcare system are not embracing the new opportunities offered by digital health initiatives?
Oh, if this will be a correct statement, in the US, we have the champions on digital health, very lot of competition in the healthcare sector, but I don't think US digital health kind of concepts is moving much faster than in other parts of the world. Mm-hmm. So it's of course we have very great example like Kaiser Permanente, that we have a complex system, but again, this is a system. It's not just one hospital which is moving because of competitiveness.
Right. So we're coming into time here, but I just wanted to ask if anyone wanted to add anything to that question, or if there's any last thoughts that you want to leave our listeners and viewers with. No? We're all good?
I think just on this last question from Jiwon is, it really speaks to the need for collaboration in all of this. I think it speaks to this panel today, Canada and the EU having conversations, and I think we need more of that. And I think the same is true for digital innovators, within, like I said, where I work in this space. And I would say I'm optimistic. There's a lot of public health groups that want to collaborate with us and want to work together. And I think the same needs to be true with commercial entities, that there's opportunity to collaborate and opportunity to tear down some of these data silos that I was alluding to before and work together. All can flourish in that future world. And I think at the end of the day, we need to come to some consensus is to not commoditize the public. Like, that's the one thing that we can't do. You cannot commercialize their health data. And so I think if we have some sort of standards, it's interesting. We have these, we talk about very complex digital technologies like AI and robotics, and we talk about, agreed upon standards for work and ways forward, and things that potential ethical lines that we wouldn't cross. And I almost think that we need greater clarity as we continue to advance digital technologies on where those lines are when it comes to digital health, so that we can all recognize the sandbox as walls and then innovate freely within those.
Excellent. And what a great ending on the sandbox analogy. I love it. Well, thank you so much, everyone, for joining me today. And thanks to all of our viewers. This has been a great discussion, and I look forward to hearing what else happens in the Thinkathon. Thanks very much.
Thank you very much. Happy to meet you.
Thank you, everybody.
Good morning as well. Bye.